Good morning, guys. It is November the 4th, and I just woke up out of bed. It is, what time is it? I just checked the time too. This is what happens when you're tired. It's like 6:45 right now. I've got the shower running. I'm going to have a shower with that Dexidin 4 detergent that I was talking about in my other video. I've been using it for 2 days. It definitely doesn't feel like soap, so just be warned if you use something like that. It's an antibacterial soap that you're supposed to use, but it doesn't suds up like a normal like soap does. It doesn't like have any suds hardly at all to it. So that part kind of sucks. But yeah, I'm going to use that. And I'm going to shampoo my hair and wash my face and everything. And then I can't eat anything. But I had a snack last night before I went to bed. And then, yeah, we'll be on our way. We'll be leaving at about just before 8. And I will continue the video when I get there to the clinic. And I'll do a little quick video in front of the sign. I'm having my surgery done at, it's called the Cosmetic Surgery Clinic, and it's Dr. Stephanie Ma that's going to be doing my surgery. I originally had paid for Dr. Schanker to do my surgery, but he had a little, I think it was a mountain biking accident, and so he's recovering from that. He's going to be there today though, and I believe that he's going to answer a couple questions maybe before the surgery happens, just to let you guys know exactly what they're going to do and that sort of thing. So I'm going to continue the video on when we get there at the clinic, and I'll do like a quick little something in front of the sign. Just say, hey, I'm here and this is where I'm having my surgery done. So, yeah, I'll talk to you guys again soon. Okay, everybody, here we are. I'm in Waterloo, and I am at the Cosmetic Surgery Clinic, and I'm getting ready to go inside. I'm gonna have my surgery at 10 o'clock. And yeah, I'm super excited, and I think everything's gonna go like really, really well. And like I said before, Dr. Stephanie Ma is my surgeon, and Dr. Schanker is the one that runs the clinic here, and he's the head surgeon, and he is amazing. And everybody here at this clinic is absolutely amazing. Everybody's super, super nice and very, very helpful. And like the bedside manners of everybody here is just phenomenal. And I can't say enough about this this surgery clinic here. And I just yeah, I'll take a little video maybe inside. Hopefully Dr. Schanker's interested in saying a couple of things, and then we'll be on our way, and everything's gonna go awesome. And I'll talk to you guys later. Bye. Okay, so here we are with Dr. Schanker, and he is the lead surgeon here at the Cosmetic Surgery Clinic. He was my original pick. He has a lot of really awesome reviews online and has good standings in the community. So we just wanted to ask a quick question for anybody who is looking into tummy tuck surgery in particular. Is there anything in particular that you would recommend people really think about, or you think is important when thinking about having a surgery like this?
Yeah, so good questions. You have to find a surgeon who has experience. Ideally, you want a plastic surgeon doing this. There are other surgeons who try to do these, and they're not quite the same when it comes to training and experience. So you want someone who's done lots. And you want someone who you have a good relationship with. You know, I always tell all my patients that once my scalpel hits your skin, we are connected forever. And so you have to make sure that you have a good relationship and a good understanding. And you have to find someone who really listens to what you want to get out of it. So that'd be my advice.
Awesome. And then the other question that I had was, can you just explain to everybody exactly what Dr. Stephanie Ma is going to be doing for me in a standard tummy tuck surgery?
So in a standard tummy tuck, there are really three important components. The first, I'll give them to you in order that they happen. The first is some liposuction, which happens in the upper tummy area and out in the flank and waist area. The second is the correction of the muscle wall or the muscle fascia. So there's some stitches that go in there to flatten the tummy, and we describe it like wearing an internal corset. And then the last part of the tummy tuck is what most people think of when they think of a tummy tuck, and that is the removal of the redundant skin and fat to make the tummy all nice and smooth.
Perfect. And this is going to be a drainless tummy tuck, which is unique for some people. They've never heard of that. What makes that different from specifically from all others?
So this is a super important question. We used to put drains in all of our tummy tucks. Everybody did. But now what I do is I use a procedure called progressive tension sutures, which do actually two things. One is they eliminate all of the empty space. We call it dead space in between the muscle and the skin flap. So you don't have this big space where you can gather up lots of fluid, so you don't need to drain because of that, and that's really good. But the other thing it does, it's not just like I'm sewing the skin flap down to the muscle. I actually am pulling it down and tacking it, and pulling it down and tacking it, and pulling it down and tacking it. So not only do I eliminate all that space, I actually take all the tension off of the skin closure, so you get a better scar as well. And that eliminates the need for a drain.
Thank you very much, Dr. Schanker, for taking some time.
I want to add one more thing.
Yeah.
When it comes to, you said how to pick a surgeon, I want to say one thing about the facility as well. If you're going to be in an out-of-hospital facility, make sure it's an accredited facility. We take that really seriously. There are lots of hoops that you have to jump through to make sure that you're offering patients a safe environment, and do your homework and make sure that whatever facility you're going to be in is accredited and they have a really experienced staff.
Awesome. Thank you so much for taking some time to talk with us today.
Yeah, no problem.
Bye.
Have a great day.
Hi. So this is the day after my surgery. I didn't do a video right after my surgery on the day yesterday just because I was pretty medicated, heavily medicated, and it's just not safe or a good idea for me to be doing a video when I'm like that. But I just wanted to let you know how things went. They took, I believe she said she took 1.5 liters of fat when she did the liposuction, which she said was quite a bit. It was a lot more than what she thought she was going to need to take. And they took more skin than what they originally planned because she said I had a lot of lax skin. So they went another inch beyond my belly button, like up above my belly button. So they ended up with 3 pounds of skin and tissue, which is a lot. Like, skin and tissue doesn't weigh very much. So when you've got 3 pounds of it, like, that's actually, that was quite a bit. So I haven't actually even seen what anything looks like yet because I'm in a corset right now, or not a corset, I'm in a compression garment that they put me in yesterday. I'm gonna see what everything looks like when I have a shower later today. I can't shower until 24 hours after the surgery time. So later, this late in the afternoon, I think I'll probably have a shower and I'll get to see what everything looks like. I'm sure it's gonna be pretty like gory looking right now. I'm probably gonna be pretty bruised up and the scarring's gonna look like not very nice right now. But it's gonna get better and better, and it's gonna look awesome when it's all healed up. So this is like a process. It's definitely a process. It's gonna take like 3 to 6 months for me to really see the results because I'm gonna be very swelled up, and the scarring needs to heal and the bruising needs to go away and all that kind of stuff. So I'm gonna need to be very patient. So it's just a heads up for anybody who is also gonna go through this process. Remember, this is a process. And the results aren't instant. You have to go through the healing process, and you have to get through to where the swelling is gone and the scars are nicely healing. and then you'll see like the full results. But I'm super excited about everything, and I'm glad that it all went very, very well, and that they were able to take so much. And she did an amazing job. Everybody was like the nicest. I've had a couple procedures in hospitals before, but this clinic, the cosmetic surgery clinic with Dr. Stephanie Ma and Dr. Schanker, every single person in that building that I was in contact with was like amazing. Everybody was like super, super nice and very gentle and compassionate and kind. And I can't say enough good things about this clinic. So if you're in the Waterloo area or within an hour's drive of the Waterloo area, I would highly recommend that you check this clinic out as an option and just put it in there on your list of options to go to one of these two doctors and at least just have a conversation with them and a consultation, because my experience there has been amazing. Like I said, I can't say enough good things about the people there and the surgeons, and like they're just so good. They were so good. Like I just feel like family now. So when I get an opportunity at some point, I'll show you like the scarring. You can see that I have like, this is like my little, this is my compression garment that I have on now. So you can see like, I'm like so much tinier now than I was. Sorry, I don't want to show my boob. Than I was before. So that's my compression garment. I have to wear it 24/7 unless I'm showering. Sorry, that's a little bit shaky there. I have to wear it 24/7 unless I'm showering, and then I have to put it right back on. So at some point I will let you guys see what things look like. Maybe later today after I've showered, I can do like just like a quick little show and tell of what things look like, so you know what to expect. And then I'll talk to you later, okay? Bye, guys.